Buoy Health Insights, Emotional Numbness. Hello, and welcome to another episode of Buoy Health Insights. If you've ever felt empty inside, unmoved by experiences, or strangely flat and unresponsive, you might have experienced what is known as emotional numbness. Today, we're diving into this topic to understand what causes emotional numbness, the associated symptoms, and when it's time to seek medical care. Let's explore how this condition affects your emotional well-being and what steps you can take to address it. Emotional numbness is when you don't experience a full range of emotions. You may feel empty, detached, and as though the color has been drained from your emotional life. Some describe it as watching life as an observer rather than an active participant. This can be particularly disturbing if you notice a loss of the sadness or happiness that you normally feel in response to life's events. Emotional numbness is typically a symptom of another underlying mental illness, such as depression, schizophrenia, post-traumatic stress disorder, PTSD, or substance abuse. One of the most common catalysts for emotional numbness is experiencing a traumatic event. The brain may protect itself by shutting down the intense emotions tied to such events, resulting in numbness. This pattern can also unfold with mental health conditions like depression and anxiety. In some cases, emotional numbness is also a response to brain cell death due to substance abuse or dementia. Certain antidepressants and other medications targeting emotional brain chemicals might cause emotional numbness as a side effect. Knowing the causes can help decipher your specific situation. Let's discuss some of the potential causes of emotional numbness in more detail. Post-traumatic stress disorder and acute stress disorder. Experiencing traumatic events, especially violent ones like robberies, assault, or combat, can lead to PTSD. You might feel detached, experience disturbing dreams and flashbacks, and desire to avoid anything associated with the trauma. Acute stress disorder refers to these symptoms appearing within days of the experience, which can eventually transition into PTSD if they persist. Treatment often involves cognitive behavioral therapy and medications. Depression. This condition goes beyond just feeling down. It persists and interferes with your daily life, work, and relationships. In cases of severe depression, you might become emotionally numb, losing interest in nearly all aspects of life. If depression is impacting you to this extent, it's essential to reach out to mental health professionals for support and possibly medications. Dementia. It's a decline in cognitive abilities, like memory and concentration, caused by brain cell damage. Frontotemporal dementia can cause emotional blunting, limiting your emotional expression considerably. While there's no cure for dementia, certain therapies and medications can help manage the symptoms. Substance use disorder. Misusing substances like alcohol or prescription drugs can disrupt your life, relationships, and responsibilities. Substances affect brain function, sometimes leading to emotional numbness. Talking therapy and medications form part of the treatment to address substance abuse. Other potential causes include side effects from medications, brain injuries, neurological issues, and hormonal imbalances. Now let's talk about when to seek medical care. Emotional numbness often develops gradually as another condition progresses. If you're feeling distressed, struggling with interactions, noticing cognitive difficulties like recent memory loss, or if your symptoms are worsening, it's important to call your doctor or a mental health professional. If you suddenly feel numb after trauma or suspect a stroke, seek emergency care immediately. And remember, if you're having thoughts of hurting yourself or others, call emergency services or go to the ER without delay. In summary, emotional numbness is usually an indicator of a deeper mental health issue and should not be ignored. Treatment often involves tackling the root cause with therapy and medication when appropriate. Remember, your mental health is just as important as your physical health. If you're experiencing any of these symptoms or know someone who is, encourage seeking professional help. And if you found this information useful, remember to like this video and subscribe to our channel for more health insights. Until next time, take care of your health and be kind to your mind.